So the top 3 most common dance injuries are sprains, strains, and stress fractures. Sprains, the first one that usually comes to mind are ankle sprains, super common, especially as the class goes on or as the performance weeks go on and you just get tired, and your muscles get tired. It becomes very easy to lose control and then having your foot turn inwards, and that's the most common way that a sprain would happen. Other things would be strains. Similarly, once you get tired after dancing for a long time, you might pull a muscle because you're trying to demand more of it than it has the capacity to do at that moment. And then stress injuries, same thing. From repetitive overuse, loading on the bone, sometimes you can develop a small crack in the bone. So in order to prevent injuries like this, having proper technique, listening to your dance teacher about proper turnout, for example, when you're if you dance ballet, turning out from the hips as opposed to from the knees really helps save your knees down the road from getting injured there. Really utilizing your glute muscles to help activate those external rotators. That I see a lot that surprisingly some dancers are not able to turn that on. So learning and practicing how to do that and increasing the endurance of those muscles is key. And then that'll translate down the kinetic chain. The other thing that is helpful is doing cardiovascular strength and conditioning training outside of dance. A common misconception is that just because you're doing a lot of explosive movements in dance, it's actually an anaerobic sport, because you'll do a combination, use a lot of energy, and then you'll go off to the side as the next group performs a combination, and then what you're doing, you're just resting. So that's more anaerobic, and you want to build up your aerobic capacity, and that's where the conditioning part comes in. So similar to the thought process in sports medicine right now, where you want to do different activities so that way you're utilizing different muscles in different ways, instead of specializing too much in one area. That's going to be ultimately helpful and make you stronger and have more endurance down the road. Dancing by itself it doesn't take the place of doing other aerobic exercises like running, cycling, swimming, something else to kind of be able to improve your cardiovascular endurance. Also, a common misconception is that if you do weight training that you're going to get bulky, and that's not true. It's actually important that you do some weight training, and it could be light weights. You don't have to do heavy weight single rep. You can do multiple reps with a lighter weight, but you're, again, improving the strength of those muscles, and that's ultimately going to help your dance practice even more. The other thing that's important too is, as you're growing, make sure that you take the energy that you put out and the energy that you take in match up. A lot of times I can see stress injuries happen when there's a low energy availability in the body, and it starts taking from fundamentals. So for example, if you have an 8-hour dance practice and you're only able to drink water and have like a handful of nuts, that's not enough energy for you. You're going to burn through that really quick, and then you're going to start utilizing energy that's supposed to help keep your muscles and your bones strong. And that's when I see a lot of stress injuries happen as well. Nutrition is super important in injury prevention, especially because then if you're not having enough energy, you're going to get tired, your muscles are going to give out on you, you're going to be more prone to sprains and strains and stress injuries. You don't have to think about it so much, just make sure that in terms of calcium and vitamin D, that's super important. A lot of times vitamin D tends to be low during the winter months because we're not out in the sun as much. So supplementing that, having vitamin D or calcium fortified cereals is going to be helpful. If you're lactose intolerant or have a dairy allergy, There's other substitutes now in the market that are available. If you want a licensed nutritionist to help come up with a plan so your energy availability in matches what you're putting out, we do have a nutritionist available through Campbell Clinic.